Question 1. In the context of patient care, Mr. Adams is a 62-year-old male patient who is undergoing a chest X-ray for suspected pneumonia. Upon entering the room, the radiologic technologist notices that Mr. Adams looks anxious and hesitates to lie on the imaging table. Mr. Adams is concerned about the potential exposure to radiation. Based on ethical principles, what should the radiologic technologist do to address his concerns? A. Reassure Mr. Adams quickly and begin the X-ray procedure without further discussion. B. Explain the potential risks of radiation exposure in simple terms and offer reassurances regarding safety measures taken. C. Delay the procedure until Mr. Adams' anxiety completely disappears. D. Avoid discussing radiation risks and proceed with the procedure to avoid further delay. Answer. Correct answer. B. Explain the potential risks of radiation exposure in simple terms and offer reassurances regarding safety measures taken. Explanation. According to the principle of autonomy, it is important to respect a patient's right to make informed decisions about their care. Informed consent includes explaining any potential risks associated with the procedure. The radiologic technologist should provide clear, understandable information about procedure and the precautions in place to minimize risks, which aligns with ethical standards in healthcare. Simply proceeding without addressing Mr. Adams' concerns would violate his autonomy and could lead to misunderstandings or distrust. Question 2. Which of the following is a critical consideration when handling protected health information? FI. According to HIPAA guidelines, A. FI should only be shared with individuals who are directly involved in the patient's care and all access should be documented. B. FI may be shared with anyone involved in the healthcare industry even if they are not directly involved in the patient's care for research purposes. C. FI can be disclosed freely if the patient is unconscious and unable to provide explicit consent. D. FI can be accessed by any healthcare provider involved in care without the need for documentation of access. Answer. Correct answer. A. FI should only be shared with individuals who are directly involved in the patient's care and all access should be documented. Explanation. According to HIPAA, Health Insurance Portability and Accountability Act, FI must be protected and only shared with individuals who have a legitimate need to know for the purpose of care, treatment, or operational tasks. All access to FI should be documented and justified to ensure compliance with privacy and security regulations. This ensures patient confidentiality and prevents unauthorized disclosure. Question 3. Mr. Thompson, a 45-year-old male, is scheduled for Aiken to evaluate a potential abdominal issue. During the pre-scan briefing, Mr. Thompson reveals that he has a severe allergy to iodine-based contrast agents. What action should the radiologic technologist take to ensure patient safety? A. Proceed with the CT scan using iodine-based contrast agents as there is no other option. B. Immediately notify the physician about the allergy so alternative imaging methods or contrast agents can be considered. C. Explain to Mr. Thompson that the allergy will likely not affect the scan and proceed with the test. D. Suggest that Mr. Thompson take an antihistamine before the scan to reduce the risk of an allergic reaction. Answer. Correct answer. B. Immediately notify the physician about the allergy so alternative imaging methods or contrast agents can be considered. Explanation. The principle of non-maleficence emphasizes the healthcare provider's duty to avoid causing harm to the patient. If patient has an allergy to specific contrast agent, this must be communicated to the physician immediately to ensure alternative measures or medications are taken. Ignoring the allergy result in severe allergic reaction, which would violate ethical and legal standards for patient care. Question 4. Which of the following best describes the principle of beneficence in healthcare? A. Acting in a way that maximizes the benefit for the healthcare provider, including minimizing personal liability. B. Making decisions that are based on the patient's preferences, even if they are not in the patient's best interest. C. Providing care that promotes the well-being of patients and actively contributing to their recovery and health. D. Ensuring that the healthcare provider follows the prescribed procedures even when they may not be appropriate. Answer. Correct answer. C. Providing care that promotes the well-being of patients and actively contributing to their recovery and health. Explanation. The principle of beneficence involves acting in the best interest of the patient, ensuring that care provided contributes positively to the patient's health and well-being. This means healthcare professionals are responsible for not just preventing harm but actively working towards the benefit of their patients, including treatments that support recovery or management of health conditions. Question 5. Given the circumstances, Ms. Clark, a 30-year-old woman, presents to the radiology department for a routine mammogram. She is visibly distressed and expresses concerns about the discomfort during the procedure. How should the radiologic technologist respond to Ms. Clark's concerns? A. Reassure Ms. Clark that the procedure is quick and painless and proceed with the mammogram. B. Acknowledge Ms. Clark's concerns, provide clear explanations about the procedure and ensure she understands the necessity of the examination. C. Tell Ms. Clark that she is overreacting and should not worry about the discomfort. D. Immediately offer pain relief medication before performing the mammogram. Answer. Correct answer. B. Acknowledge Ms. Clark's concerns, provide clear explanations about the procedure and ensure she understands the necessity of the examination. Explanation. The principle of autonomy requires healthcare providers to respect a patient's right to make informed decisions about their care. In this case, acknowledging the patient's concerns and providing clear explanations about the procedure ensures that Ms. Clark is fully informed, respects her to understand the process, and fosters a trusting healthcare environment. This approach is consistent with ethical standards in healthcare. Question 6. What is the primary objective of performing hand hygiene in a radiology department? A. To prevent the spread of infectious diseases and ensure a clean environment for both patients and staff. B. To protect the radiologic technologists from direct contact with the patient's body fluids during imaging procedures. C. To reduce the risk of radiation exposure to the healthcare provider during the imaging procedure. D. To ensure compliance with hospital regulations and maintain professional appearance. Answer. Correct answer. A. To prevent the spread of infectious diseases and ensure a clean environment for both patients and staff. Explanation. Hand hygiene is a critical practice in healthcare settings, including radiology, to reduce the risk of infection transmission. Proper hand hygiene prevents healthcare-associated infections highs by minimizing the spread of pathogens from patient to patient or between staff and patients. This is an essential part of control practices, ensuring a safe and hygienic environment for all individuals. Question 7. Dr. Patel has been asked to perform a contrast-enhanced CT scan on a 50-year-old male patient, Mr. Harris, who has a history of kidney disease. Mr. Harris is worried about the possible impact of the contrast agent on his kidneys. What is the most appropriate action for Dr. Patel to take in this scenario? A. Reassure Mr. Harris that contrast agents are safe and proceed with the CT scan. B. Perform the scan without contrast to minimize risk, assuming Mr. Harris' condition is stable. C. Discuss with Mr. Harris the potential risks and benefits of using the contrast agent and explore alternatives. D. Cancel the CT scan altogether to avoid any potential complications. Answer. Correct answer. C. Discuss with Mr. Harris the potential risks and benefits of using the contrast agent and explore alternatives. Explanation. The principle of beneficence and non-maleficence obligates healthcare providers to make informed decisions that maximize patient benefit while minimizing harm. In cases where there is a risk to the patient, such as kidney disease, it is essential to communicate the risks of using contrast agents, alternatives, and make a shared decision based on the patient's health status. This approach respects the patient's autonomy and promotes safe care. Question 8. Which of the following is a key responsibility of a radiologic technologist in the context of legal and ethical practices? A. Always follow the radiologist's instructions without questioning them, as they have the final authority. B. Document patient interactions accurately and ensure that all records reflect the patient's history and condition. C. Perform imaging procedures independently without consulting other healthcare professionals. D. Inform patients that they will be responsible for paying any additional fees related to the imaging procedure. Answer. Correct answer. B. Document patient interactions accurately and ensure that all records reflect the patient's history and condition. Explanation. Accurate documentation is an essential legal and ethical responsibility in healthcare. It ensures that there is a complete and accurate record of patient care, which can be used for medical decisions, legal purposes, and continuity of care. Failing to document or making inaccurate records could lead to consequences, violate patient trust, and result in patient harm. Question 9. During a routine X-ray procedure MS, a pregnant patient expresses concern about the safety of the procedure for her unborn child. As the radiologic technologist, what should you do? A. Reassure MS that the X-ray is harmless and proceed with the procedure. B. Explain the potential risks of radiation exposure during pregnancy and discuss whether the procedure is necessary. C. Tell MS that her pregnancy is not a concern and proceed without addressing her concerns. D. Cancel the procedure immediately without further discussion, assuming it may harm the baby. Answer. Correct answer. B. Explain the potential risks of radiation exposure during pregnancy and discuss whether the procedure is necessary. Explanation. According to the ethical principle of non-maleficence, it is important to consider the risks of any procedure, especially when it could potentially harm the patient or their unborn child. A responsible healthcare provider should explain the risks involved, explore alternatives, and only proceed if the procedure is This maintains patient autonomy and ensures informed consent as recommended by the American College of Radiology guidelines. Question 10. Which of the following best describes the importance of informed consent in healthcare? A. Ensures that healthcare providers are legally protected from malpractice lawsuits. B. It allows the healthcare provider to proceed with a procedure without the need for further communication with the patient. C. It ensures that patients understand the risks, benefits, and alternatives to a proposed procedure and agree to it voluntarily. D. It is primarily intended to protect the healthcare facility from financial liability in case of adverse outcomes. Answer. Correct answer. C. It ensures that patients understand the risks, benefits, and alternatives to a proposed procedure and agree to it voluntarily. Explanation. Informed consent is a fundamental ethical and legal requirement that respects the patient's autonomy. It involves providing the patient with clear, comprehensive information about the procedure's risks, benefits, and alternatives, ensuring that the patient can make an informed, voluntary decision. This protects both the patient and the healthcare provider by ensuring transparency and understanding. Question 11. In the context of ethical principles in healthcare, Mr. Anderson, a patient undergoing a radiological exam, expresses concern about the procedure causing him harm. He has heard rumors about potential risks associated with the imaging procedure. What should the radiologic technologist prioritize in this situation? A. Immediately proceed with the procedure as it is routine and safe for most patients. B. Encourage Mr. Anderson to sign the informed consent form without further discussion. C. Address his concerns and explain the procedure, benefits, and risks, ensuring that he is fully informed before proceeding. D. Assure Mr. Anderson that he should not worry about any potential risks as they are very unlikely. Answer. Correct answer. C. Address his concerns and explain the procedure, benefits, and risks, ensuring that he is fully informed before proceeding. Explanation. According to the ethical principle of autonomy, patients have the right to make informed decisions regarding their care. The radiologic technologist must ensure that Mr. Anderson has a clear understanding of the procedure and its associated risks, allowing him to provide informed consent. Simply with the exam without addressing his concerns would violate his right to make an informed decision. Question 12. Which of the following best describes the legal and ethical implications of violating a patient's confidentiality in a healthcare setting? A. The violation is generally not a significant issue as healthcare workers are protected under the concept of good faith confidentiality. B. The violation may lead to criminal prosecution and civil lawsuits, and the healthcare provider could face disciplinary actions. C. As long as the information is not publicly shared, the violation does not have serious consequences. D. Violating confidentiality is only a concern if the information share related to a highly sensitive medical condition. Answer. Correct answer. B. The violation may lead to criminal prosecution and civil lawsuits, and the healthcare provider could face disciplinary actions. Explanation. The Health Insurance Portability and Accountability Act (HIPAA) enforces strict guidelines around patient confidentiality. Violating confidentiality can lead to both criminal and civil penalties. Health professionals must ensure that protected health information (FI) is not disclosed in practice, as such breaches can have serious legal and professional consequences. Question 13. During a radiology exam, a 60-year-old female patient, Mrs. Harper, refuses to undergo the procedure because she is afraid of radiation exposure. What is the appropriate action for the radiologic technologist to take? A. Proceed with the procedure without further discussion as it is necessary for her treatment. B. Inform Mrs. Harper of the safety measures in place and offer to answer any questions she may have. C. Ignore her concerns and explain that radiation exposure is insignificant in the context of the exam. D. Proceed with the procedure immediately as it is required for diagnosis, regardless of her fear. Answer. Correct answer. B. Inform Mrs. Harper of the safety measures in place and offer to answer any questions she may have. Explanation. The radiologic technologist should address the patient's concerns by providing clear information about the procedure and the safety measures in place. According to the ethical principle of beneficence, healthcare providers are obligated to act in the best interest of the patient, ensuring they understand and are comfortable with the treatment. Diagnostic procedure. Question 14. Given the circumstances, a radiologic technologist must determine the best way to communicate with a non-English-speaking patient who requires imaging. Which method is most appropriate for ensuring clear communication? A. Using non-verbal communication alone, such as hand gestures. B. Asking another patient who speaks the same language to translate. C. Using a professional medical interpreter to ensure accurate communication and understanding. D. Relying on family members or friends of the patient to provide the translation. Answer. Correct answer. C. Using a professional medical interpreter to ensure accurate communication and understanding. Explanation. For accurate and effective communication, especially in a medical setting, using a professional medical interpreter is essential. This helps ensure that the patient fully understands the procedure, its risks, and the expected outcomes. Relying on family members or other non-professional interpreters could lead to miscommunication and patient safety. Question 15. When analyzing a radiology report, you notice a discrepancy between the imaging results and the patient's clinical symptoms. How should you respond? A. Report the discrepancy to the physician and document it in the patient's records. B. Ignore the discrepancy, as the imaging results are likely more reliable than the patient's symptoms. C. Consult with a colleague to confirm that the symptoms are unrelated to the radiological findings. D. Modify the report to match the patient's symptoms for consistency. Answer. Correct answer. A. Report the discrepancy to the physician and document it in the patient's records. Explanation. Ethical and legal standards require that any inconsistencies or discrepancies between clinical symptoms and radiologic findings be addressed. The radiologic technologist should communicate the issue with the physician and ensure that proper follow-up is conducted. This supports non-maleficence, ensuring that no harm is caused to the patient by the discrepancy. Question 16. What factors should a radiologic technologist consider when determining the appropriate radiation dose for a pediatric patient? A. The patient's age, size, and the specific imaging procedure being performed. B. The general guidelines for radiation dose in adult patients, as pediatric patients are treated similarly. C. The patient's level of distress during the procedure. D. The doctor's preference for the imaging technique. Answer. Correct answer. A. The patient's age, size, and the specific imaging procedure being performed. Explanation. Pediatric patients are more sensitive to radiation than adults, and the appropriate dose must be adjusted based on factors such as age, size, and the type of imaging procedure. Adhering to the principle of justice, the radiologic technologist must ensure that the patient receives the minimum necessary radiation to achieve diagnostic while minimizing unnecessary exposure. Question 17. In light of recent developments, what is the primary reason why radiologic technologists must remain up to date with changes in healthcare laws and regulations? A. To avoid personal liability in the event of a lawsuit. B. To ensure the health and safety of patients and maintain professional standards of care. C. To ensure that radiologic procedures are completed as quickly as possible. D. To protect the hospital or medical facility from any legal action. Answer. Correct answer. B. To ensure the health and safety of patients and maintain professional standards of care. Explanation. Staying informed about the latest healthcare laws and regulations is crucial for ensuring patient safety, maintaining the highest standards of professional care, and preventing violations of legal and ethical responsibilities. Technologists must adhere to laws such as HIPAA and state-specific regulations to provide safe, high-quality care. Question 18. Mr. Martinez, a 45-year-old male patient, has been referred for an imaging procedure that he feels is unnecessary. What should the radiologic technologist do in this situation? A. Reassure Mr. Martinez that the procedure is essential and proceed without further discussion. B. Inform Mr. Martinez that the decision for the procedure was made by the doctor and cannot be questioned. C. Explain the reasoning behind the procedure and allow Mr. Martinez to express his concerns. D. Encourage Mr. Martinez to refuse the procedure if he feels it is unnecessary. Answer. Correct answer. C. Explain the reasoning behind the procedure and allow Mr. Martinez to express his concerns. Explanation. In accordance with autonomy and beneficence, patients have the right to understand and participate in decisions about their care. The technologist should ensure that Mr. Martinez understands the rationale for the procedure and respects his concerns. This empowers the patient to make an informed decision regarding their care. Question 19. Which of the following is the most effective method to ensure that a patient's protected health information 5 remains secure during transport between departments in healthcare facility? A. Transporting the information in paper form without encryption. B. Sending the information through unsecured email to avoid delays. C. Utilizing encrypted electronic communication or secure physical transportation methods. D. Allowing the patient to personally transport the information to the next department. Answer. Correct answer. C. Utilizing encrypted electronic communication or secure physical transportation methods. Explanation. HIPAA mandates that Phi be protected during all stages of its handling. When transporting Phi, encrypted electronic communication or secure physical methods should be used to maintain confidentiality. Using unsecured methods, such as paper forms without encryption or unprotected email, puts the patient's information at risk. Question 20. When considering emergency procedures in the imaging environment, which of the following is the first action a radiologic technologist should take if a patient collapses suddenly in the examination room? A. Immediately call for help and begin CPR if necessary. B. Wait for medical staff to arrive and take no action. C. Move the patient into a comfortable position and wait for the situation to resolve. D. Document the incident before taking any other steps. Answer. Correct answer. A. Immediately call for help and begin CPR if necessary. Explanation. In an emergency situation, the priority is to call for assistance and begin life-saving interventions, such as CPR if required. The radiologic technologist must act quickly to ensure the patient receives immediate care and follow the established emergency protocols to maintain patient safety. Question 21. A radiologic technologist is asked by a close family friend to reveal the results of her husband's imaging study. She insists that he would want her to know. What should the technologist do? A. Disclose the results because the request comes from a family member. B. Ask the radiologist to deliver the results since they are more qualified. C. Politely decline and explain that patient confidentiality must be maintained unless consent is given. D. Provide general information about the procedure but not the results. Answer. Correct answer. C. Politely decline and explain that patient confidentiality must be maintained unless consent is given. Explanation. Under HIPAA and ethical guidelines, no one is permitted to access or receive patient information without proper authorization or consent. Even close relatives are not exceptions unless explicit permission is granted by the patient. Question 22. A patient expresses distrust in the healthcare system due to past discrimination. As a radiologic technologist, how should you address this concern? A. Acknowledge their feelings, listen actively, and treat the patient with empathy and respect throughout the procedure. B. Explain that discrimination is no longer an issue in modern healthcare. C. Ask them to focus on the imaging and ignore past experiences. D. Suggest that they reschedule when they are more comfortable. Answer. Correct answer. A. Acknowledge their feelings, listen actively, and treat the patient with empathy and respect throughout the procedure. Explanation. Patient-centered care requires empathy, cultural sensitivity, and active listening. Recognizing and validating the patient's concerns without dismissing them builds trust and ensures a respectful care environment. Question 23. During a fluoroscopy procedure, a technologist realizes that the cumulative dose is exceeding the recommended limits. What is the best course of action? A. Proceed with the exam to ensure complete diagnostic images. B. Stop the exam immediately, inform the radiologist, and discuss alternatives. C. Ignore the dose levels, as short-term exposures are usually harmless. D. Complete the exam, but reduce the frame rate to limit further exposure. Answer. Correct answer. B. Stop the exam immediately, inform the radiologist, and discuss alternatives. Explanation. The ALARA, as low as reasonably achievable, principle prioritizes patient safety. Any potential for harm due to excessive exposure must be addressed immediately by stopping the procedure and exploring alternatives. Question 24. A fellow technologist often skips verifying patient identity to speed up the workflow. What should you do? A. Confront the technologist privately and report the behavior to a supervisor if it continues. B. Ignore it, as it does not directly involve your assigned patients. C. Join them to improve efficiency if the patient load is high. D. Advise the patients to remind technologists to verify their identity. Answer. Correct answer. A. Confront the technologist privately and report the behavior to a supervisor if it continues. Explanation. Verifying patient identity is a safety-critical process. Failing to do so can lead to severe consequences, including misdiagnosis and incorrect treatment. Ethical obligations require reporting unsafe or negligent behavior. Question 25. A patient undergoing MRI discloses they have an implanted medical device but are unsure if it is MRI compatible. What should the technologist do? A. Proceed with the scan, assuming the device is safe due to the patient's lack of issues. B. Check the patient's electronic records for device specifications and consult with the radiologist. C. Cancel the scan and refer the patient back to their physician without explanation. D. Begin the scan and monitor the patient for signs of discomfort. Answer. Correct answer. B. Check the patient's electronic records for device specifications and consult with the radiologist. Explanation. Implant safety is critical in MRI procedures. The technologist must confirm compatibility using official device documentation or consult clinical staff to avoid serious harm to the patient. Question 26. You overhear two coworkers discussing a patient's medical condition loudly in a hallway. What is the most ethical response? A. Walk away, as confronting coworkers may cause tension. B. Join the conversation to make sure no misinformation is being shared. C. Remind them privately that such conversations should occur in secure private areas. D. Report them to human resources without informing them. Answer. Correct answer. C. Remind them privately that such conversations should occur in secure private areas. Explanation. HIPAA requires all patient information to be shared discreetly. A respectful reminder maintains professional integrity while ensuring the breach doesn't continue. Question 27. Which of the following best aligns with the principle of justice in medical ethics? A. Ensuring that all patients, regardless of background, receive equitable access to imaging services. B. Explaining the risks and benefits of an imaging procedure to allow informed consent. C. Avoiding harm to the patient by minimizing unnecessary exposure. D. Encouraging the use of the latest technology regardless of cost. Answer. Correct answer. A. Ensuring that all patients, regardless of background, receive equitable access to imaging services. Explanation. The principle of justice focuses on fairness and equality. In healthcare, this means ensuring patients receive equal care without discrimination based on race, socioeconomic status, or any other factor. Question 20. During a portable X-ray in an ICU, the technologist notices the exposure field includes an area unrelated to the clinical indication. What is the appropriate action? A. Proceed with the current field since repositioning may disturb the patient. B. Reduce the exposure field to the area of clinical interest before proceeding. C. Inform the physician and proceed based on their instruction. D. Take the image and annotate the area that was not clinically necessary. Answer. Correct answer. B. Reduce the exposure field to the area of clinical interest before proceeding. Explanation. Radiation protection standards dictate collimating to the region of interest to limit patient exposure and improve image quality. This is part of adhering to ALARA principles. Question 29. A patient wants to decline a ICNA that was ordered by their physician. How should the technologist respond? A. Encourage them to proceed to avoid upsetting the referring physician. B. Document the refusal, inform the physician, and respect the patient's decision. C. Tell them that they cannot refuse procedure ordered by doctor. D. Proceed with the scan anyway if the patient is in the room and hasn't signed formal refusal. Answer. Correct answer. B. Document the refusal, inform the physician, and respect the patient's decision. Explanation. Patients have the legal and ethical right to refuse treatment. The technologist must respect the patient's autonomy, ensure proper documentation, and notify the ordering physician for further guidance. Question 30. An elderly patient is unable to remain still during a lengthy imaging procedure. What is the best course of action? A. Continue the exam, accepting the possibility of motion artifacts. B. Secure the patient physically to reduce movement. C. Pause the exam and consider comfort measures or a modified technique. D. Sedate the patient without consent to complete the procedure quickly. Answer. Correct answer. C. Pause the exam and consider comfort measures or a modified technique. Explanation. Technologists must prioritize patient comfort and safety. Adjusting the approach, modifying the technique, or using aids like supports or breaks is ethically preferable to forcing compliance or compromising image quality.